What is up, YouTube? I haven't posted a video in a while. Um, Actually, most of my videos are about back pain. Um, and one of my last back videos, I talked about having revision surgery from a fusion that didn't really fuse correctly. So the neurosurgeon went in from the front, took out everything, uh, put the new stuff in, cage and all, screws at L4, L5, 90% better. I'm able to walk a mountain, exercise. I'm not doing anything crazy. Every now and then I'll jog a little bit, going up a little small mountain here in Georgia. But what I want to talk about today is I just turned 60. I had my yearly physical, and my doctor, we're in there talking. Oh, you've lost 10 pounds. You look great. Everything seems good. I'm going to run some blood tests. Well, everything was great. My diet and all that, and talking to him. Well, I get a message from him on their portal saying, hey, your cholesterol's high, blood pressure's good, A1C, glucose, all that's good. We want to put you on a statin. So, you go on the internet and there's cardiologists saying statins are the greatest drug ever. Then you see studies and it looks like they're not as good as people say. There's some side effects. Then you hear another cardiologist say, I would never take a statin. I've been doing keto for probably 20 years now. And I'd say 90% of the year I eat low carb. I do the test strips showing that I'm in ketosis. I've played around with carnivore a little bit. Lately, I've been doing carnivore, but eating mixed nuts, broccoli, tomatoes. The tomatoes, because on that same blood test, my PSA came up high. It was like 6 something. So, who knows? I had a meeting with a urologist appointment. They want me to retest April 1st, so April Fools. Hopefully my numbers have dropped. Some things that could raise your PSA levels, but I kind of planned for the test, so didn't really go crazy doing anything that would have raised it. But yeah, there's so much confusion out there. But it's like I told my wife, I said, I will not take a statin. I would rather die from a stroke or a heart attack. And who knows, in 6 months or a year, that may happen. I don't know. But there's so many little things about statins. People say, well, if they were that good, why is heart disease still the #1 cause? I'm one of these people, like if somebody could break it down with studies and say, this is exactly what you're supposed to eat. This will prevent heart attack and stroke. This will make you live longer and feel better. I have no problem eating it. If it's eating 1 apple a day and some eggs and this and that, I could do whatever it is. But as consumers, we don't know what's right. So I feel like my weight's good, exercise is good. My other videos, I've got a Smith machine here, treadmill, weights, hot tub, sauna, cold plunge in the morning 5 days a week. I do the VO2 workouts, which are pretty tough, 2 days a week. I walk at least 7 days a week, honestly. Now, one day a week, I may not go 5 miles. Sometimes my wife and I will do 2 miles in the morning, 2 miles later, maybe a little more like 3 in the morning, 2 later. Some days we'll do 1 mile, but that's like maybe a Sunday, or a Thursday, knowing the next day I'm going to go really hard on the VO2. But yeah, it's just so confusing. You know, you lift weights, you eat super clean, like as far as sugar, you know, no sugar in my diet. Like I said, I'm doing keto. I've done it. Every now and then I'll go off keto and eat, you know, like a hamburger with the bun. Usually I'll get the lettuce in the bun, no fries. I'll do broccoli. You know, I got a lot of friends who are in better shape than me. You know, I see them, they eat fries, they eat pizza, you know, not crazy amounts. They're super healthy as well. But it's just so confusing. But I figured, hey, I'll do a video on this. You know, is cholesterol good? You need it for your brain and all that. You hear that. I would love to know what's the truth. Like anything else, there's a lot of myths out there. So I'm just trying to figure it out. And if this helps anybody, again, I don't do these videos to get views or likes or make money, any of that. I've never made a penny off a video I've ever done. Mainly for me to go back and look at. I think my body fat percentage is 18%. You know, I feel like I'm super healthy. You see people on the street who are, you know, 50 pounds overweight. Maybe they don't have high cholesterol. Maybe they take statins. I don't know. Again, I'm not really sure that lowering your cholesterol lowers your risk of heart attack and strokes. I feel like genetically my cholesterol has always been high, but when, you know, I started really thinking about it 20 years ago, you know, I was already doing keto and always staying pretty fit. So, yeah, if you have any comments, if anybody has any experience taking statins, not taking them, I'd love to hear what other people think. Like I said, I'm going to kind of journal my progress. And again, you know, I told my wife, if something happens, I'm fine with it. Like I said, I'm 60, you know, I want 10 more years, maybe 15. My parents both died at 84. My grandfather died at 84. I tell my wife all the time, 84 is probably when I'm going to drop, but I'm also way healthier and eat way better than my parents or my grandfather ate. So there's that. And hell, I don't want to live to be 100 if I'm, you know, limping around or can't get out of the house, or mentally, you know, dementia setting in, or Alzheimer's or something like that. So, yeah. You got any advice? You got any comments? Love to hear them. And I'll keep you updated. Trying to keep these under 10 minutes. I know I tend to be long-winded sometimes. Just trying to get every little thing in there. You know, I keep track of my VO2 max, you know, everything that you can, pretty much. I'm not one of these David Attia guys is that his name? David or Matt? Maybe it's Matt. Getting them confused. There's so many out there. But, you know, I'm not doing biopsies and things on muscles and all that crap. But as far as just, you know, keeping, you know, spiral notebook every year of workouts. things like that, injuries. You know, I've had some injuries, some shoulder injuries lately, just not feeling right. But, you know, and that, you know, another one, you lift weights, you start getting stronger, increase the weight, and the next thing you know, you got a shoulder injury. So that's the plan. And hopefully this can help some people, and hopefully whoever does the studies can give us some better information, and we'll see what happens. Thanks.